All right, now I believe I can still say good morning, but it's almost noon, so okay, now good afternoon. It's now March 19, and I have more things to say for the data update, so I want to quickly say this is part one, how Israel vaccinated their way out of the pandemic. And I want to scroll through all that to go to part two. I told you that if we follow Israel's path, there will be a coming bump in cases and possibly a bump in hospitalizations. I will be very surprised if there's a significant bump in mortality, especially on a nationwide level. There might be some localized outbreaks, there might be some localized bumps. And so you should watch for that in your own area. But I want to show you how to watch for that, because the easiest way to present the data is not the best way. This is kind of like all the lessons of science right here. Just because something's easy to measure doesn't mean it's the best predictive quality. And I want to remind you of another of my common themes in these data updates. There's lots of data we can look at. There's 4 different data streams: cases, hospitalizations, and realize that that can be reported as data admitted or currently hospitalized. I prefer the latter, but you can't always get it. And then the most important, but also the slowest one to gather is deaths from COVID-19. So we've got to keep our eyes on all that, but we need something faster because we can't reverse death. And so we want to be able to figure out what policies we need to have in place before that happens. And finally, we now have vaccines administered. Thankfully, in the last couple of months, we've actually been able to see more data coming in along these lines than in the first 3, which is great. So I want to show you some of the data from the King County COVID dashboard. And I want to say that, yes, we are past the peak. I felt like I was going a bit out on a limb when I said on January 1st that I thought it wasn't going to go up again. I'm glad to say it hasn't gone up again. It's gone down, but it's been flat since mid-February, flat in terms of cases. And yet it's been flat, but it hasn't been flat. Look down at the test positivity down there. The test positivity has been dropping. So it's been flat in the context in which testing has happened more. There have been more tests coming in. And actually the target test positivity is 2%. Right now we are at 2.1%. So we are actually near our previously stated target. And what I want to do is, as the data says, we've stated that we have these targets. Okay, well, how are we doing on the metrics? For test positivity, we're actually doing okay. Hospitalized cases and deaths are the more important data streams in cases. And notice that those are continuing to drop rather precipitously in a pretty much straight line that you can see. Maybe it will tail off at a very low level. But we've got 5 people who were admitted in King County in mid-March, the first week in March 7th or something like that. 5 people out of 2.2 million people in King County. That's good news. And another thing that I do is I compare these data to Snohomish County data, because the counties collect data differently, but they really have so much migration and so much population similarity, they pretty much follow each other. So I can use, like, if King County has a bad data day, then Snohomish, I can look at Snohomish and I can say, oh, they had a normal day. It's probably just a blip in the data. And when I look back and forth, I see these same trends in Snohomish as well. Look at how low that deaths line is. Look at how low that hospitalized cases is. Those lines are much more encouraging to me than a flat cases line is to be discouraging. Believe me, I want this to come down as well, but a highly transmissible disease that has a very age-dependent IFR, infection fatality ratio, perhaps this is the best we can do right now. We have to consider the whole effect and not just look at one metric for how things are going. Not to mention, this is all just looking at the virus. How do we look at the other parts of life and decide what needs to be done? That's a policy question. And honestly, I'm out of my depth a bit as a scientist. We've always got to realize all scientists are out of their depth when it comes to policy decisions. We've got to make those together as a people based on informed opinions based on the data. So here's the statewide data for Washington State hospital beds, and you can see this is dropping as well. It's grayed out for the last week, and it might be tailing off a little bit, plateauing a little bit. This is statewide, and the thing I want to point out for this is, yes, we did have a peak that was higher than any previous peak on a statewide level, just a little bit higher than the April peak, definitely a lot broader, And also, this is well within the capacity of the healthcare system to handle. Let me zoom in on the data just since the beginning of the year, and you can see it's a pretty steady drop down. Again, maybe a little flattening recently. Let's keep our eye on that. But so far, it's like a small cloud in the sky. I don't think it's going to pour if I just see a cloud in the sky. And also, we need to put this in context of the entire healthcare system. The simplest way to do that is by beds occupied. At this very peak of the whole epidemic for the statewide level, 150 beds were occupied. From my calculations, it looks like there's about 1,000 beds overall. So that means that 15% of the beds were occupied by COVID patients when it got very worst. At the same time, we were restricting access to hospitals, and so it ended up being about bouncing around 80% of the beds total occupied. Now it's at the same place. COVID has gone down. We've relaxed some restrictions. Hospitals are 80% occupied. And that is our previously stated target as well. Some days we're we're like at 81, 82%. But we're bouncing around 80%. And that was our previously stated target. We've been within that target pretty much for the whole course of this. COVID has not hit Washington's healthcare system as hard as almost every other state. Maybe the exceptions would be Oregon, they would be Maine, and the New Hampshire, the other corner of the country. The two northern corners of the country have gotten off the best from this when it comes to the healthcare system. So our healthcare system is well within capacity, and it appears to be doing okay. The other thing you have to consider is healthcare workers, because you have to have people to staff those beds. But again, we have not had a sustained stressing of the system like we've had in nearly every other state. We have not had that here. And so I think that we're doing okay when it comes to the healthcare. Currently, if my estimate of 1,000 beds is correct, we're currently at 3% of our beds are occupied by COVID patients, within the range of what it can handle. And Snohomish County also reports people on respirators right now. If I remember correctly, the number of people currently on respirators in Snohomish County, which is about 10% of the Washington population, is 2. If we can extend that out, there's probably about 25 people on respirators in a whole state, in a state of 8 million people. The healthcare system is doing okay. Now we have to be worried about, could a fourth wave happen again? But that's the whole reason why I want to be a proponent of vaccinations. And so now that COVID, my favorite site, went offline because they said the CDC is doing okay on this now. And so now I'm going to the CDC to get state-by-state hospital data. And the cool thing about that is they actually do projections. Now again, projections are just basically taking the line and extending it into the future. So we can't be exactly as certain that there's not some game changer out there. From the experiments I've seen, I don't think there's a game changer out there in anything but vaccination bringing this down. I don't think the variants are going to change this outlook very much. So I think these forecasts are pretty much valid. And I want to say I've gone through all 50 states of forecasts. And this is what I see over and over again. I see the red line on the right that you see right here, and it's flat. The Washington State hospital projections, and you see the black dots are going down. Hospitalizations have gone down since January 15 in this case. And this is the case for Washington, as I've just showed you. It's the case for Florida. The Super Bowl did not get in the way of this. We still have hospitalizations going down. It's the case for Georgia. Georgia opened some things early. People predicted there would be a huge wave. And there was a wave at the same time that everyone else got the wave. There are some differences. Policy does matter. But it doesn't matter it's not the only thing that matters. In fact, I'm not sure it's the primary thing that matters. I think individual behavior, individual choices are as important as policy. And so you see these things with Florida and Georgia, and I really should look up Texas, but I know I flipped past it because I know that I looked at all the lines that were either flat or going down, except for 2 states that were going up, and they are not Texas. So these are what 48 states look like. And by the way, the UK variant, what about the variants? The UK variant is more than 50% of the cases in Florida, and yet hospitalizations are still going down at the same level as everyone else. From what I've seen, I believe that the UK variant will cause a plateau or maybe a bump in cases. But I would not call it a spike. I would not say that there's a potential for explosive growth. We were worried about that before. I think from the data we can see right here, for this variant, we don't need to worry about it. What about the other variants? Well, I don't know for sure, except to say if you're worried about the South African variant, what's the data doing in South Africa? It's falling off a cliff right now. There might be a wave that we have to get through to get to that point, but I don't see any evidence that there's uncontrolled exponential growth out there in the cards, especially at this rate of vaccinations. That doesn't mean that we let everything, it doesn't mean we stop vaccinating, right? We just keep on this path. But the path looks like it has an end to the road, a light at the end of the tunnel that we are taking. Here are the two states where we do see projections going up, and you can see the red lines. These are an ensemble forecasts, so it's Minnesota and Michigan. Like usual, geographically, states are, the geographic thing seems to be a primary determinant of how these curves play out. I don't know what the different policies are in Minnesota and Michigan, but I'm sure that they haven't had identical policies, and yet they seem to have the same risk of disease right now, that they have hospitalizations that are risking actually going up, maybe. Minnesota looks like it's more likely to be flat, but I included it because clearly it could go up. And Michigan is the one place where we actually do see cases and hospitalizations going up right now. Why is that, comparing state to state? Maybe that'll be a topic for a future video that I do, because I want to do these things, and I want to do them according to the data, not according to preconceived notions of, I like that person, therefore I want that state to do well, therefore they're doing well. I see a lot of that reasoning. And I want to get this away. This has to do with policies and politics, but primarily the data that are collected speak independently from that. And so let's go back and check. Let's see how these different states did. I don't know about you, but I'm a little bit tired of dire predictions and then nobody going back to say, hey, you said that thing a while ago about how the Super Bowl would cause Florida to spike. That has not happened. Here's the data right here. Super Bowl was back in mid-February. It was a month ago. There's no sign of hospitalization increases in Florida at a statewide level. And I've also looked at the county level for the Super Bowl, by the way. I've checked. There does not appear to be a bump, at least last I checked, from the Super Bowl or the UK variant. What's going on in Europe is another question, but I've got to separate that from what's going on over here. We can take that information and we can show that in, and I want to say the Europe third wave looks like it's real, and maybe that's a future video that I'll talk about. So anyways, I've talked long enough today. Thanks for listening, and as always, let me know if you have any comments or questions, and I'll try to answer them, especially when it comes to questions about a particular state. I can look it up. You can also look up your own state using this web address right here. Like I said, the CDC is now getting it done, which is cool. All right, everyone, I hope this helps. Be patient. It's going to be a couple more months, but maybe that's all it's going to be. We'll see. And in the meantime, when you can, get vaccinated. I think I've said that plenty of times. All right, see you soon.